Okay, so we asked some people, like, what are some questions that you have for your gynecologist that maybe you've just been a bit, too uncomfortable to ask? So one of these is, what do I do if I feel uncomfortable at a doctor's appointment? I know they're looking out for my health and that no one's judging me, but it just makes me feel uncomfortable, especially if I'm on my period. What would your advice be to
Yeah.
somebody who feels like this way, this way?
I think communication, right? I think that even though it is uncomfortable, I think you have to speak up and say what you're comfortable with. And I think that we need to normalize that. I think there is this old model of medicine, of paternalism, where the doctor is the boss. And if they tell you to get undressed and get in the stirrups, that's what you're going to do. But if you have any concerns or you're not comfortable, let us know what that is, and we might say something to you to try to reassure you. But if you're still uncomfortable, speak up, because no one should be forcing you to do anything that you're not comfortable with.
Yeah, I think too it can be helpful. I've been in some situations where it's made me feel better if I say, please can you just sort of tell me what you're doing as you do it, right? So you
Yes.
know what's coming next, you know what to
Yes. And I
expect.
think doctors should really err on the side of doing that.
Mhm.
I do a lot of different types of procedures while patients are awake, like intrauterine inseminations, which are done in the office setting. And sometimes I do them for other doctors' patients because they come in on a certain day. So
Okay.
I don't know, what their level of comfort is. So I always err on the side of talking them through every step. And some of them will say, this is, my fifth one. Like, you don't need to do that. And I'm like, oh, okay, well, that's just my thing that I always do, because I
Yeah,
just feel like it's easier to know what's happening down there when you can't see, and anticipate what the next step is. So I think it's always good as a doctor to err on the side of caution when it
yeah,
comes to that.
yeah, yeah, I think so too. Um, so somebody has said that they don't like how there are so few pictures of sort of regular period blood clots out there. They say I just have blood mixed with normal vagina discharge. Is that what a clot is?
No, a clot is actually blood that has sat there for a while. Sometimes it's because it's pooled in those corners or the fornices of the vagina. And anytime you have sitting blood, it is going to clot because there are clotting factors and platelets in it. And so it kind of congeals and becomes this like semi solid clot. It's not because of the vaginal discharge. Now, vaginal discharge covered in blood could look like a clot too, but that's not why it's happening. So blood clots form when there's just blood that's sitting there, whether it's sitting there and pooled in the reproductive tract as it's coming down slowly. Some people's blood clots faster than others. That's just the different makeup of their blood components. Blood can be dark. That usually means it's been oxidized. So it's been sitting there and exposed to the air. And it can be bright red, which is more of a fresh bleed, right? So there's different consistencies and different colors, and it has to do more with what the blood is made up of, and how long it's been sitting there and how long it's been exposed to the outer environment.
Yeah, that's really helpful to know. And that sort of ties actually to the next question, which is there any truth to different blood colors meaning different things for your health? Because you're talking about this kind of being
Yeah.
stages of time, right, that the blood has been sitting in the body or coming out, but they're wondering, does light mean that you're dehydrated, or if it's dark, does it mean you're sick in some way? And somebody also was asking, it seemed to be brown for the first 3 days. Why is that? Like before it gets lighter.
Yeah. I think that there's a lot of different reasons that go into all of that. And it's very hard to study because all of us are so different and there's so many variables that influence the consistency and the color of the menstrual fluid. It's very hard to link it to certain states or behaviors, right? Like being dehydrated, for example. I feel like Chinese medicine puts a lot of stock in this. Like if you go to an acupuncturist, they'll ask you these types of questions, and it is really interesting. And I wouldn't refute it and say that there's nothing to it, but I think it's hard, and I would be careful about brushing with broad strokes when it comes to this because you're comparing different people. I think it's important to kind of go back to the fundamentals and understand, well, what causes dark brown blood versus bright blood, and why does some blood clot and some doesn't. I think going back to the physiology and the biology of it all, you can make more sense of it. But I think there's so many steps in between linking it with things like being dehydrated and then how it comes out and looks. I think it's hard to really know. So we as OBGYNs in Western medicine haven't quite figured that out yet, if there is a very distinct pattern. Um, but I think, things like the example of having brownish discharge in the first couple of days before a full blown period, it makes sense to me because, things don't happen with like a light switch on and off with our
Right.
bodies. So it's like a gradual breakdown. And because it's a small amount, it's probably taking a very long time to exit the reproductive tract, which allows it to become oxidized and dark, and it's scant because it's a small amount. So all of these things make sense, I think, if you understand why, like what the biological basis is.
Yeah, 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 exactly. Lucky, this is great. Thank you so much. Yeah, really appreciate your insights all into this, and you just give such concise answers that are just yeah, really, really helpful.
Well, I love doing this. So I would love to come back on and answer any other questions that people have because this is my passion and what I love to do. So thank you for having me on.